So welcome everyone. My name is Jordan Catcher, and for the last 15 weeks, I've been the instructor for a new course that we have developed, which is called Listening to and Elevating Multicultural Communities, the Case for Equity During COVID-19. I work for the state of Utah. And I started instructing with the university this past summer. And I've had the pleasure of working with an incredible TA named Claudia, who you'll be able to meet very shortly, who has really been able to put together a very beautiful workshop that we're very excited to showcase for you all today. We're going to go over a little bit of housekeeping, but just as a reminder, I have hit the recording button. So this whole meeting will be recorded. If you are interested in receiving a copy of the recording, please let me know. You're more than welcome to just message me through the chat in Zoom. Or to just email me afterwards. I'll provide that as well. So a little bit of a background into these workshops for those of you that may be unfamiliar, or I know some of you have talked with our students, some of you have presented in front of our students, and some of you, this is the first time you've interacted with us before. So welcome. Thank you for being here, especially on a Thursday evening. This listening to workshop, the University of Utah has been enacting listening to workshops for the last decade or so. And really the purpose of the workshop is to listen, which, it might seem kind of simple, but it's really a very deliberate practice for us, especially as planning practitioners, to intentionally listen and better understand our community members. Traditionally, before the pandemic, we would meet in communities. We would go to grocery stores, to city halls, to organized events, and just listen, interact with local residents, and try to get a better idea of how do they feel about their community? What would they like to change? What do they love about it, etc. And then once the pandemic hit, we really had to shift gears and figure out how to take an experiential workshop and make it virtual. So I've actually never met any of the students in person. We've all been connecting with each other once a week since 15 weeks ago. So with the intention of listening specifically, we really wanted students to be able to just practice that just in and of itself, but also, in a time such as, 2020, connection is more important than ever. And so I'm really excited for you all to listen to what our students have been able to put together this evening. And I'm going to hand it off to Claudia, who will be able to give a greater description into how we shaped this workshop and what are some of the housekeeping tips for the presentations this evening. Thanks, Claudia.
Thank you so much, Jordan. So as Jordan mentioned, my name is Claudia Loiza, and I am the Special Projects and Community Engagement Coordinator with the Utah Division of Multicultural Affairs. And this semester-long workshop was facilitated in partnership with the division to provide a real-world community connection to the goals of this class. So I have the honor of working with the division, and I'm also a master's student in the City and Metropolitan Planning program here at the U. And I facilitated this partnership, and I want to thank my director, Nubia Pena, who I think is here with us, and a few of my fellow MCA team members for supporting me and providing the time that was needed to do this. And COVID-19 response has been a significant effort led by the division at the state level, and students were provided with insights from practitioners and frontline service providers on how equity is being centered and how in the future it could be better centered in emergency planning and response. So I'm just really grateful to have been able to kind of build that bridge between the two groups and help students understand the importance of collaboration, especially during this time. So a little overview of what we've learned in class, just the structure of this workshop. We had a guest speaker series where community leaders and frontline advocates joined us to discuss class topics in depth using real world examples. And this really helped us dispense resonating advice and guidance for all these future planners and community developers. And a lot of these guest speakers are here with us today, and we're hoping that more will join. But we're just really grateful for their participation and for all their incredible experiences that they've shared with us over the course of the semester. Another component of the class that we had were weekly lectures that we lovingly termed crash courses. And these were centered on topics that you see here on the screen related to equity, but specifically centered COVID-19 impacts on communities of color and other racially and ethnically diverse groups. So these discussions really help build student capacity to understand racial equity and justice for many different facets and applications. For example, when we discussed health equity, we not only explored the current health impacts on communities due to COVID, but also the deeply rooted systemic barriers to care and healthy living, such as understanding the social determinants of health, access to health insurance, historical factors in medical care, cultural stigma, and the exposure of frontline workers that have had to the virus, and how a disproportionate share of those are from communities of color. So like I said, a very holistic approach to what equity means and hopefully being able to understand it from a systemic lens. And finally, the culmination of these capacity building experiences prepared students to then perform interviews with some frontline service providers to then help inform a follow-up report on COVID-19 impacts among multicultural communities here in Utah that the division will release in the next coming months. So students will also share their findings and analyses of these interviews in a summarizing report on the importance of actively listening to community. So really alluding back to the impact of intentional listening that Jordan was mentioning and culminating all this into a nice report that we can share on our division website and through the university as well. So we just want to thank you to those who participated in these interviews and really provided that key qualitative data needed to affirm the need for equity now and into the future. Lastly, I just want to share how much our students have grown over this past semester. We had a practice session last week and both Jordan and I were just like tearing up, seeing and hearing how much these students really understood the need and the intersections of equity. And they've been ready to learn, grow, and really even to discomfort and some uncomfortable conversations that we've had surrounding historical oppression and oppressive systems. So, you know, for many, these topics were new, but for others, they were highly aware. But over the course of the semester, there really was an open-minded desire to understand better, to identify what systems needed changing, and also acknowledge the role of history in all of this. And so from my personal experience with these students, I've learned that, you know, change happens one person at a time, and that equity-minded education, just that, it's education. It's long-term and ever developing. I myself am a constant student in that, and I really hope that these students, I do have that hope that these students will shape the future of our systems and further perpetuate the idea, hopefully, that equity, having an equity lens isn't just limited to a job title or a job description, but really becomes a mindset. So with that, it's my pleasure to pass the time back over to Jordan, who's going to explain how our student presentations are going to go for tonight.
Perfect. Thank you so much, Claudia. Yeah, just like Claudia had mentioned, you know, we had our students do test runs 2 weeks ago, and they were very phenomenal. And so we're really excited to showcase these this evening. I wanted to mention that the presentations are, you know, roughly 75% research and then 25% reflection. This workshop is very, very focused on that reflective element. So every week after guest speakers, our students would reflect on what they heard and sort of what they're sifting through. And so that's really been embedded and very intentional for us throughout this time. So with that being said, we do have 4 teams this evening that will be presenting. Each team will be presenting for 15 minutes each. After each team presents, we will open it up for 5 minutes for questions. That's when you can, if you feel comfortable enough, you can unmute yourselves and ask questions to the students directly. Or if it's more preferable, you may also use the chat to ask your questions. After that 5 minutes, just because we want to be mindful of time, if you do have additional questions, feel free to just throw those in the chat, and the students can also address those as other teams are presenting. And also for those of you that are interested in receiving the recording for this evening, as well as the final deliverable, just let us know, and we're more than happy to connect you to that. So with that being said, we're going to start out with our first team, which is focused on communication. So I'll let you all take it from here.
Alrighty, everyone. So hello, my name is Beatrice, and then my other two team members are Haley and Ethan, and we are the communications group. So the topic that we will be covering today in our presentation is communicating with communities and touching on the experiences of navigating the COVID-19 pandemic in Utah related to communication. So we will first give a brief introduction on the importance of communication, and then we will transition to the information gathered from our lovely interviewees, and then we'll touch on the reoccurring themes and specific recommendations that emerged from the interviews, and then we'll close it off with our reflections and concluding remarks. So now onto our topic, communication. What is communication, and why is it a principal topic to cover during a global pandemic? What's the big deal, like this little guy is saying over here in the corner? So the big deal is that the ability to communicate indicates the existence of a relationship between parties that allows for the exchange of information, knowledge, and experiences. So proper communication between the state and its diverse communities is essential in relaying information regarding COVID-19 that could potentially be life-saving. Though taking that into consideration, there are several communication barriers that are actually blocking the line of communication between state officials and multicultural communities in Utah that disable equitable access to information or resources. So we must recognize and address our biases in order to create lasting equity in our society.
So again, why communicate with these frontline service providers? So it is only through direct communication that you'll really understand the truths and the nuances experienced by these frontline service providers. We've gathered that these nuances include the spread of misinformation, language barriers, literacy accessibility, and lack of access to translated documents. And we also talk to them to amplify the voices of people of color in multicultural communities who may be, underrepresented by American standards, especially in Utah. So all of the information we gathered will work toward a second official report from the Utah Division of Multicultural Affairs. So in our process, we've interviewed 4 people. We have Kevin Wen, who works for the Utah Department of Health, Rosina Lake, she's a Spanish Public Information Officer with the state of Utah COVID-19 response team. We have Edwin Espinal, he's also a Public Information Officer and also works for the Utah Department of Health. And then we have Belia Paz, she's a DJ and radio host with Aerostar Media. So these 5 questions are the questions we asked each of our interviewees consistently. And we'll just deep dive into the themes that arose from each. So one key quote we gathered from Kevin is, "Structural inequities have always existed. The pandemic has simply exposed and amplified them." And this brings us to the 2 themes that emerged within his interview with us, which is the consideration of the digital divide and community health workers. So even before the pandemic, many people didn't have access to technology, chose not to use it, or just are technologically illiterate. So we really need to consider each method that people choose to gather their information from. So community health workers is pretty much just another term for trusted members of multicultural backgrounds who convey this crucial information like what PPE to use and how to stop the spread to everyone who aren't as fluent in English.
So our next key quote is, the barrier is that we're speaking 2 different languages, but the language itself is not a barrier. And that came from Edwin Espinal. So despite Utah declaring English as a primary language used or spoken, we have a multitude of languages used by different communities. So it's in identifying those differences in language as assets rather than communication barriers, we can improve our relationships with multicultural communities. And another way to improve those relationships would be recognizing how people access information in their language. So we need to be thoughtful and cognizant of every avenue individuals choose to take to obtain information. And a lot of multicultural communities tend to be more trusting of their own communities. So they look to within, whether it be their own family members or their friends or their neighbors, to gather essential information, especially during the pandemic. So we can use that knowledge as a path towards solutions that adhere to their own cultural behaviors.
Rosina Lake said that with multicultural communities, something you have to always think of are their values and how you convey information. So with that, we've really found that tailoring information to cultural values is of the utmost importance. Information is best conveyed if you put it into a cultural context. So for example, Rosina said that oftentimes Latino and Hispanic communities have a great emphasis on family and keeping family safe. So when we're speaking about the COVID-19 pandemic, instead of just saying do this, do that, you could say social distance, wash your hands, stay home so that you can protect your family from becoming ill. It's a very slight variance, but it could help a lot in really reaching people and making the message more meaningful. And another item that arose was just repetition. All messaging should be presented repeatedly for the highest impact. And when we were speaking with Edwin, he spoke about the Rona campaign, which was geared towards younger individuals, such as ourselves interviewing or presenting today. And to his dismay, none of us actually recognized the Rona campaign when we spoke with him. But the thing is, we had probably seen it. It's just hadn't been enough times. We hadn't seen it enough to really embody it. And since then, it's everywhere. But that just really highlights the importance of constant repetition of your message to really make sure it's heard. And Bilia Paz said, "We've got to stop judging people and step up to the plate and help." Through her interview, she just embodied compassion. And so what we learned from her is to approach people without bias. In times of crisis, anybody should be able to access the help they need without criticism. And so the pandemic doesn't discriminate, so how could we possibly discriminate? And one very key theme that she hit on was the need for multimedia communications. She works with radio stations, and so she would have callers calling in, requesting information on the pandemic, and if you tried to redirect them to a website or social media, a lot would respond and say, is there a hotline I can call? Is there someone I can go physically talk to? Are there any pamphlets that I can find? So we really need to understand in which ways communities prefer their information to be given and distributed, and make sure there are multiple avenues in which you can access that information. So our first 3 policy and action recommendations are here. The first was very important to keep diverse leadership. We need to ensure that there's diverse multicultural representation at all levels of government so that we can better understand the needs of all communities and their members and understand their unique struggles. Another key item is to simplify messaging. We found that it would probably be best to create messaging at roughly a 5th grade reading level so that you can capture your entire audience. You're not leaving anyone behind that might not be as literate, but the most important thing is that it's more easily translated when it's at that lower language level. And quicker translation is the best. And then tailor the message towards cultural values. Releasing information that's culturally relevant allows it to be better received and understood more effectively, so it can be really be embodied.
Yeah, so a few more policy and action recommendations we've gathered from each of these awesome interviewees. Kind of going back mainly to Kevin's is the multimedia approach to spread good information on the pandemic. We really need to be broadening this information to websites, social media, flyers, definitely more analog approaches for the digital divide. So like, phone hotlines, radio, and also pamphlets would be another good one. And kind of thinking back to Belia's, she really stressed that we need to offer help unconditionally. Because, as Haley said, the COVID-19 pandemic doesn't discriminate. So neither can we when we need to help people through it. So socioeconomic status, whatever language you speak first, your citizenship status, and obviously your race should not be an issue. And also, one thing I've learned this semester is that Utah has a law that requires or doesn't require any information to be basically made in other than English, which I find to be pretty ridiculous. So we basically recommend that Utah require that information be made in all languages spoken that we know of, which Edwin Espinosa is actually around 20. So a little reflection from me I think this was just a really eye-opening experience and kind of mind-bending experience, because I consider myself an activist, but it's really when you talk to these people that you truly realize how underrepresented they are. So yeah, it just truly made me realize the depth of the work that's needed to bring more equity to society.
Then going along with what Ethan said, I think one of the most valuable things that I gathered from this course and interviewing people that are actually dealing directly with multicultural communities is recognizing the need to work with already existing frameworks within our government or our society that make space for people in order to make space for people to be heard. And while also challenging those frameworks that need improvement. So that could be our own biases, deficit language that we use that can render groups lesser, or our own privileges that we might not notice without being engaged with communities like this. So being cognizant of these existing frameworks really allows us to engage with communities and communicate with them in more meaningful ways.
And my experience with this workshop and interviewing these frontline service providers was that communications and outreach, you really need to go to where the people are and be thoughtful of the impacts of your messaging. Now, obviously, it's a little different with the pandemic to not physically approach people where they are, but just meaning that you can't expect people to come to you. You really have to do your best to approach them in a meaningful way. It's really easy to get yourself into this silo when you're creating messaging or any outreach and you think, oh, this is perfect, but you really have to stop and think about how it might be perceived by different groups, or if it would really be understood by everybody, or if, you know, it's just too technical or there's too much jargon. So having other people check your work is really important, and just really thinking about your community as a whole and how that will be interpreted. And then our main conclusion, as this course is nicknamed, is just to listen. We must listen to the needs of our communities in order for them to be met. Nobody understands all walks of life, so it is important to include representatives from all multicultural communities.
And with that, just a big thank you to everybody, to Edwin Espinel, Rosina Lake, Belia Paz, and Kevin Wen, and really just to every frontline service provider out there, because this is an unprecedented time and you're definitely doing the real work. So we thank you. So yeah, we can open it up to some questions if anybody has one.
I don't have any questions. This is Kevin, but that was a fantastic job. And I just want to say I appreciate everyone from Multicultural Affairs, Claudia, Jenny, Nubia, you from Rosanna, everyone in this class to take the time to build all of this and share the message with us, because I think it's so impactful. So just wanted to say I appreciate you all.
I think Stacy, did you have, I saw that you unmuted yourself as well.
Oh, I was just going to ask the students, you know, how do you translate what you learned in this class to maybe what you're going to be doing when you graduate, and kind of your career focus? Do you see how that information, what you've learned in this course transfers over to what you hope to be doing in the future?
Yeah, absolutely. I think this class definitely, like more than ever before, has definitely made me think about like an equity focused, just way of thinking. So I guess if I ever become a planner, I would always kind of run through my mind, like, is this an equitable decision for everyone? So yeah, just generally that kind of thing.
Yeah, I spent some time interning with Salt Lake City Transportation, and This course really made me think back on the communications that I provided during that time and really understand what was lacking and how much improvement there is still needed. And I know a lot of that's just going to come with time and practice, but I'm really focused on that moving forward and providing equitable, clear communications from government officials especially.
And then I think for me, I think this course has really made me a lot more aware of my own privileges. And, being a woman and a woman of color, I still have my own privileges. Like I speak English fluently. I mean, I'm very light skinned. So I think I just want to be a lot more aware of my own privileges and biases so I don't project that onto communities when I actually engage with them, because I think I want to be working directly with communities just so they can be better heard and so I can better listen to them without projecting my own beliefs or biases before.
So we have 2 more minutes for questions. And again, if you feel more comfortable, please feel free to put your questions in the chat as well.
Hello, this is Iris. I could ask a question. So the city is like considering an accessibility policy. So with languages, it's complicated, right? Because like we have the like the Disability Act, and those things are required by the federal government, and there's no such a thing for language. But I was wondering, did you find any key documents that you would think, 3 key documents that you're like, those definitely need to be translated?
So I'm not sure about my other 2 presenters, but I didn't find anything that desperately needed to be translated simply because the people we were interviewing were doing that as their jobs, translating. So Edwin specifically, he is a public information officer. He was telling us all about his work in translating documents to several different languages. And he was the one that really talked about the need to use plain language. So it is easier to translate that information and provide it more quickly, better turnaround time. Sorry, I'm not sure if that entirely answers your question, but that's the experience that I had in this.
Hi, this is Marianne, and I want to thank you all for your presentation and the invitation to be here tonight. And I'm curious, as you thought about the kinds of messaging, the amplifying, the diversity of languages, did you see intersections of opportunity around accessibility for people with disabilities and the kinds of ways in which messaging was made accessible in those ways that are at least at the very initial stages or can be built or grown? Very curious. So again, thank you for the great presentation.
Yeah, thank you also. That's a good question. So I think in terms of disability, what comes to my mind first is someone who's not able to understand English as well. So I think the one way we really need to combat it is keep things in plain language. So in every language, obviously, we should have things at probably like a 3rd or 4th grade reading level. That way everybody can understand it.
Okay, so we are up at around 6 minutes. I know that there may be more questions. I thank everyone for asking questions, and but please feel free to ask those in the chat. And again, the students from each team are more than happy to answer those questions through that platform as well. So we're going to segue to our next presentation that focuses on health equity.
All right, so hello everyone. I'm Megan Brewington, and my 2 teammates with this project were Emma Bailiff and Badir Almadi. And so we're going to discuss the topic of health equity. So we'll talk a little bit about the project and then go over who we interviewed, some of the main themes that we got, their policy suggestions based on what we observed, and then our consensus in the reflections regarding the project in this class. So first and foremost, like this data focuses on the frontline service providers that help communities get reliable information on COVID-19, their health services, and those who also deliver resources or aid to anyone of those communities during this time. So we will be sharing the analysis of their interviews as well as their perspectives, experiences, policy suggestions during or regarding the effects of COVID-19. Health equity in underrepresented and marginalized communities has been an issue prior to COVID-19, but this year it was really heightened and worsened. So by reaching out to these frontline service providers, we have gathered the following themes and policy suggestions to help reduce the misinformation, language barriers, and limited health access in these communities.
Perfect, thanks, Megan. So I'm going to go over a bit about the interviewees that we talked to and kind of give a better context of some of the main themes that came up. So our first one, Teresa Sanchez, works for the Utah Health Policy Project, which is a nonprofit, nonpartisan organization, and it's focused on advancing sustainable healthcare solutions for underserved Utahns. And they advance these solutions through better access, more education, and public policy. So this is kind of where Teresa does the more legislative and policy part of things, but she also works with Take Care Utah as a health access assister. And this is kind of the Utah Policy Project's second part, and where she would do a bit more of the personal work, like helping people enroll in Medicaid or the marketplace, and then educating them on that. So most of these people that she helps are in underserved communities that have high amounts of low-income families, immigrants, refugees, and people who just don't have access to healthcare. So then our next one, Areta Tupola, she is specifically on a project with the University of Utah at the moment. So in a clinical setting, she's a community healthcare worker. Specifically, she focuses on Pacific Islanders with health disparities, chronic diseases, and just dealing with other social determinants. She's the one that helps connect them to resources, and there are plenty in need of this. Pacific Islanders take up about 3% of all COVID cases in Utah, and they're only 1.6 of the total Utah population. So she's also a section coordinator at the Public Health Coalition, which is super cool because she's the one that develops the certification for community health workers. And they're doing the groundwork and helping run COVID testing centers, dropping off food to families, and doing a lot of trying to help educate people on what quarantine and isolation really means in their own language and in a way that's relevant to them. And then our next one, Jeanette Vialta, is she works for the Alliance Community Services as a community healthcare educator and as a COVID-19 program coordinator, which is also a nonprofit. She also works with the Multicultural Counseling Center, doing counseling and a lot of education. And her duties kind of reminded me of Teresa's as well, but mostly working with multicultural communities in general and specifically immigrants too. And then our last interviewee chose to remain anonymous, but they're part of the Navajo Health Systems team that started a public health department that really focused on visiting at-risk families to get them resources for educating them and making sure that they have the resources they need to make things, even just like appointments. So they're kind of unique because they deal with an investigating agency role with the pandemic, but only deal with the Utah side of the Navajo Nation cases rather than the New Mexico and Arizona cases. So they're public, but not county health. And then I'll just go over some of the main topics that came up in just about every single one of our interviews. So the first one is misinformation. It's probably the biggest problem and common theme. So we heard the statement that language was a huge barrier multiple times, and it can come in a few different forms, but there's either just a lack of translated information in general, or it's poorly translated to begin with, which ultimately makes it so the information isn't accurate or it doesn't make any sense. And then a lack of internet plays a role in this too, because without the internet, it just increases that struggle of being able to translate it or search for information. And then sometimes there's just a lack of understanding around our healthcare system and insurance processes. Sometimes people just haven't seen it before and it's harder for them to navigate. For example, we heard our last interview, we talk about members in the Navajo Nation who might just be sick and need something as simple as Tylenol. And instead of paying out of their pocket, they can have a doctor write a prescription, which will allow the Indian Health Service to pay for it. So small things like that, they might always not be common knowledge. And then the next point that was brought up several times was how much testing and mass testing is lacking. And again, several factors add into it, like transportation. If you are not able to get there, you can't get tested. And the lack of free testing and eventually some of the cancellation of it has made people not want to come and get tests because they don't know how it will affect their insurance. On the other hand, some don't want to come get tested because you have to present an ID, which could put their documentation at risk in that situation. And a lot of times, Jeanette mentioned also there were testing sites around, but they would be closed on the weekends, and a lot of these families would have to spend their entire week working to provide for their family, and the time that they have off, the testing centers are closed. So more availability is super pressing there. And then the last common theme I'm going to touch on is the presence of community leaders. Throughout the pandemic specifically, the interviewees had found that having a community leader be the one to help convey COVID-19 information is really effective. People in the community aren't really, I mean, nobody would want to listen to someone that you don't trust, right? So specifically in Utah, a lot of times this is looking like a pastor or a ward leader. So with that, they also usually speak their language, and that helps in translation and information conveyance. So the key is to really identify and get those figures involved.
Hello, this is Badar Almadi, and now I'm going to be talking about policy and suggestions from our interviewees. So from the frontline service providers, one of the main problems that we are having is that access to healthcare. So we don't have that many places to make people get tested for COVID. Most of those places is in the main areas like downtown or areas that are busy. But if we go like deep in the community, we don't see like many testing areas. So providing more testing areas, or maybe we make health worker travel to their houses to get tested, will reduce the amount of the virus. And another thing that is one of the interviews said that healthcare should be available for all the community, citizen or non-citizen, documented or undocumented, to reduce the number of cases. And then the second issue is affording more time. With time, there are many people are working during the week, like 10 hours or more sometimes. So they don't have the time to come and get tested. So opening during the weekends or making the testing hours longer can help more people to get tested. And this also will reduce the amount of the virus in our communities. And And also with this, like we will also help many people, especially the multicultural community. And the third issue that many of the interviews agree with is language accessibility. Language play a massive part in our community. And without understanding our rights or the information that we need to know, we will have a hard problem understanding the right and how we can deal with the virus as well. So since we have like so many multicultural in the US, affording more languages to people to know their rights can help reduce the amount of the virus. For example, in Navajo Mountains, there are like a family that get the virus, and then after they did the quarantine and all they tested negative, and still they were facing a hard time for them to get back to the community because the community think that they will affect them or they still have the virus because of the lack of information. So if we afford more information about how they can deal with the virus and how they can quarantine, we will save more people from the virus, and at the same time we will help people to get back to the community. And the other reason is transportation. So transportation is very important for the policy and suggestions uh, that we can afford for people. So if we make the test, like if we cannot build a public transportation system, at least we can make something like making the system the health worker travel to their houses and to do the testing for them. So to reduce the amount, as I mentioned before, and also because with that we will have like more people that we will have more healthier community that can get access to healthcare and also get engaged, get back and engage with the community. And the other thing is that you guys remember when we had the storm that hit by Salt Lake cities and many trees falling apart. So there's one of the great examples that they did in Navajo Mountain. They took these trees to bring it back to the Navajo Mountain area and to use the wood to build their houses or to build more equipment for those people. So here's another suggestion that help us to take advantage of the things that if there's like a storm hit and what we do with the thing that is falling apart or something like that is to reuse it for the community. And that's all the suggestion. And yeah.
So to talk a little bit about the kind of conclusion and our reflections. So the interviews have proven to show that communication in underrepresented and underserved communities needs to be prioritized way more than it already is. So many people in these communities are misinformed and afraid to reach out and get the help that they need because many are not sure what they can and cannot do or should and shouldn't do during these times, especially because of extenuating circumstances like a lack of transportation, health disparities, maybe a lack of health insurance or no knowledge of how to use health insurance, and then other factors like citizenship and documentation. So, as a little bit of a reflection, interviewing these frontline service providers was a very unique experience in which we got to engage with the people who are actively working with and helping underrepresented communities during COVID-19. There are so many organizations in place that can help those in need of aid, whether it's medical, financial, housing, rent assistance, etc. It's very enlightening to hear all of the incredibly amazing ways that people are able to reach out and are willing to devote so much of their time and energy and efforts to help these people and these communities get back on their feet. And with that, listening does not just mean conversation. It means processing the information you're learning and implementing an action to reinforce it. So for a bit of like a personal reflection about this class and just about this project, for me, it was really nice to know that there are always people willing to help. So if you feel that your opinions are not being voiced, you can always reach out to someone who has the power to speak up for you without like changing or like miscommunicating the information that you're trying to tell. And so as a planner or as a future planner, if you have an idea, it's really important to make sure that it will work effectively with all communities before it like backfires and is super inequitable. So all underrepresented communities, marginalized people need to be prioritized because most of the privileged communities have really easy access to all of the like resources and aid that the marginalized and underrepresented communities don't.
Yeah, so Megan, you hit it on the nose. I pretty much just want to echo everything you said, but the main thing for me, and again, like what this class's whole purpose is to listen, but I've always heard it's really effective and really important to listen twice as much as you speak. Um, and it's just so relevant because nobody knows the situation like the person that's in it. So that's, you always should take that into consideration. And as I like take this hopefully into my career in planning, I just think it's so important to consider health equity in all aspects of it, because everything is going to affect our health in some way.
And for me, like the main reflection, like this all interviews and the class open my eye, and makes me look about equity in a different way. Equity is really important for our communities, and also especially with health equity, we all need healthier communities, and with healthier community we can be stronger, and we can be produce better, and we can engage together, and yeah, and help all the country to grow. So and also listening is very important. That's what I learned from this class. Like it is very important for us as a future planner. If we want to help the community, we have to listen to them and to do what they need in their lifestyle.
So we just one final thank you to all of the beautiful people that we interviewed, to everyone who is here in this Zoom call tonight. And then a big thank you to like Jordan and Claudia for getting this project set up in such a seamless fashion.
Perfect. Thank you so much. So we're going to open it up for 5 minutes for questions. So similar structure. If you feel more comfortable to unmute yourselves, please feel free to do so and ask your questions. Otherwise, we'll look at the chat as well.
I can ask a question. Could you guys talk a little bit about why it is so hard for us to listen? Because at one level it seems like such an easy thing, yet we don't do it. So maybe you could talk a little bit about why it is, do you think we don't listen enough in terms of those who are in positions to make change and to impact people's lives? Why are we still telling people to listen? Like we've been saying this for a long time. We still don't know how to do it.
I think one of the things that Emma said in her reflection really is what I think of hearing this question, where it's like you're not going to know the situation as well as like someone who is actually in the situation. So instead of trying to assume that like you have the best answer to things, it's really important to make sure that it will actually work. Because I feel like as planners or as architects, or pretty much with any position, it's like if you come up with a great idea, you want to just put that idea and you just think it's the best idea ever. But for everyone else trickling down at the other end of it could be just the worst thing ever.
So it looks like we have a question from Jake in the chat, which asks, could you talk about some of what you learned about the spatial aspects of healthcare from your interview, and how can you as planners affect the spatial challenges?
Sorry, can you repeat the question again?
Yes, of course. And this is in the chat too. So if you all want to open up your chat. So Jake asks, could you talk about some of what you learned about the spatial aspects of healthcare from your interview, and how can you as planners affect the spatial challenges?
I
Would
don't
you mind?
really know a good
Oh, yeah.
answer to this one. Yeah, like go ahead and take the spotlight.
I was just hoping you could elaborate a little bit on what you mean about spatial aspects.
Yeah, of course. Jake, are you able to unmute yourself?
Yeah, sure. So as planners or designers or architects, as you mentioned, you are makers and effectors of space. So I'm curious, as you think about from your interviews, when I'm spatial aspects, you know, like distance, community form, less about policies and more about the physical attributes of the communities these people live in. If you gathered any information from your interviews that affected, or maybe you thought about that, yeah, Stacy, that's great. In transportation services, did you glean any information from your interviews that helped you maybe realize the spatial components to inequalities when it comes to healthcare?
You know, we didn't dive as deep into that as I would have loved to, but yeah, I mean that's definitely a factor. We just didn't quite hit on it as much. Badar, I don't know if you had anything to add to that, but
I feel the only way that we can make more access to healthcare for community to be more equal is to provide more places for testing area. And also, I think this is like gonna help the society, and transportation also plays a big role in having the equity of healthcare. So yeah, and as a planner, I think like we should plan in how to make healthcare more equal for people, and how to afford accessibility to people that do not have it. That's all I can say about this question. I hope that I answered the question.
Wonderful. And I know that there was another question in the chat as well. Since we're at the 5-minute mark, for any of you, Emma, Bada, or Megan, if you'd like to address those questions, please feel free to do so in the chat. And let's segue to our third presentation for the evening, which focuses on housing and social services.
Okay. All good on the screen sharing?
Yeah.
Okay. Oops, sorry, wrong button. Okay, we're good.
Okay, so my name's Macy and my group mates are Jason and Bianca, and we are on the Housing and Social Services team. So to start off our presentation, we decided to include a large number of 42.4 million that you guys are looking at, which represents the amount of pounds of food that has been distributed by the Utah Food Bank since March, when the pandemic hit. The demand for food assistance has gone up 300% since then, which is obviously, yeah, a very large number. This in relation to our research because social services does entail food banks and other types of food assistance. Here's our table of contents. So what we will be going over in this presentation will be our housing and social services background for some additional info and data findings. Then we will be transitioning onto our interview process and interview our interviewees or present our interviewees and organizations they're affiliated with, as well as the questions we ask them during our interview process. And then we will be going on to our themes, main themes that we found most prominent during the interviews and sub-themes in relation to those. Then we will be going on to our policy and action recommendations and concluding with my group mates, individual reflections on the course and interview process in general. So here's our introduction. The purpose of this was to research how underrepresented communities have been impacted by the COVID-19 pandemic through the lens of frontline service providers, in our case, in the housing and social services field. The insights we have found will be used to create a report on these ongoing impacts, which will be released by the Utah Division of Multicultural Affairs. So what does housing and social service encompass? Basically, it's the benefits and facilities, including housing, education, food subsidies, healthcare, adoption and foster care, community management, and policy research, as well as a couple others I didn't write down. Throughout these interviews, my team was able to comprehend and pinpoint the main reasons for these impacts and insecurities during the pandemic. So based on these findings in the Multicultural Needs Report, housing insecurity was found to be one of the most prominent issues. Some data findings we found throughout our research, one from the Salt Lake Tribune news article and one from an interviewee, both in relation to housing insecurity, were in the 6 months since the coronavirus pandemic came to Utah, the Lantern House Homeless Shelter in Ogden has served 1,116 new people experiencing homelessness, 45% of whom say they are unsheltered for the first time, which is very unfortunate in light of this pandemic. And on another note, in 2020, there were 1,700 less evictions than there were in 2019, where there were 6,000 evictions in Utah alone. This decrease was because of the eviction regulations were more lenient in light of the pandemic, and because federal and state protection programs were present. This inevitably helps those struggling to pay for rent for various reasons, lost jobs and stuff like that. And I'll be handing it over to Bianca to go over our interview process.
Hello, everyone. So I'll be going over the interview process and our interviewees. So we got the chance to interview Anais Salcedo, who is a grassroots organizer with United Way. She's a community organizer in the Salt Lake area, specifically focusing on communities on the west side of Utah. Also from United Way is Mustaf Hussein, who is an informational specialist serving anyone seeking assistance or resources during hardship through the 211 toll line. Another interviewee was Rocio Torres, who is a family support manager with Neighborhood House. She specifically works with low-income communities seeking affordable housing and other social services. Our last interviewee is a housing and social services leader in the community serving statewide Black, Indigenous, and people of color. Okay, so the questions that we used in our interview were, what have you observed as the most common reason for food insecurity during this pandemic? What improvements or declines have you seen in housing security for your clients since the pandemic began? How has COVID-19 impacted your ability to help people access affordable housing? How can we move from spotlighting gaps in social services to solutions? Beyond identifying the needs, how can the system of social services be more equity-based? And what unforeseen gaps in basic needs have you encountered with your clients as a result of COVID-19? So from these, from our interviews, 3 main themes came up. So the themes were accessibility, trust, and persistent. So we'll each be explaining these themes and their sub-themes. So a reoccurring theme throughout our interviews was the challenges and barriers regarding accessibility. So consistent with the Multicultural Needs Report, there are still a lot of unique barriers and challenges regarding access to basic needs, such as food, childcare, and housing. So while public, private, and nonprofit agencies are providing more resources and services, there are still a lot of barriers and challenges making it difficult to obtain what's being provided. So some of the sub-things related to accessibility were language and literacy, technology, transportation, and eligibility requirements. So a quote from an interviewee related to this theme was from Mustaf. So the quote was, "The unemployment application for some people, they were not able to access the unemployment application because they don't have Wi-Fi, didn't have internet, and didn't have a computer at home." So a little bit more about each sub-theme. So these are the challenges and barriers that we identified throughout our interviews. So for language and literacy, a lot of forms can be difficult to understand when they're not translated properly or in a timely manner. Also, if they're not clear and concise, so if they use a lot of jargon and vocabulary that isn't accessible to everybody. With technology, forms are not easily accessible if they're only provided online. And with transportation, some resources and services are not physically accessible to everyone, especially those that don't have a mode of transportation like a car. So going to a food bank might be more difficult. And eligibility requirements. So these exclude marginalized communities with different situations and circumstances that exclude them from a lot of different services and assistance being provided, such as those without documentation. So a quote related to this, still with this accessibility, is, "The people that need it the most are people who don't have Social Security, who don't maybe have all that money, don't have the time to get it translated." And this was from Anai.
So the main theme that I went into depth on that we saw a couple times throughout our interviews was the importance of trust for frontline service providers and how COVID-19 took away the face-to-face interaction, which caused difficulty in terms of connecting with those in need. This was found to be a large issue and why individuals with housing and food insecurities are not accepting or seeking assistance they need. A sub-theme relating to this, just as important, was that many individuals that need these services do not trust the government for various reasons, which leads to those denying assistance. So these 2 quotes on the right were taken directly from 2 of our interviews, one from Rocio and one from Anahi. So I'll read these aloud. "Unfortunately, a lot of our mixed status families do not feel comfortable accessing these types of services in any way, since it might be putting them in jeopardy by outing them and their immigration status, or just putting themselves at the forefront of the government." And another quote in relation that's very similar was, "Because folks sometimes just don't trust the government. That's simple as it is." And then again, like I said, community members and also people who have been marginalized several times just don't trust the government because it has harmed them instead. So it's like, how do I trust this policy is going to help me and not harm me? So those 2 quotes do pinpoint the main reasons why individuals don't trust the government in some situations, even though they do need the assistance.
The third main theme that we identified was just from the perspective of our service providers, just the idea of persistence. So you must, it's a very difficult field to be involved in. You see a lot of people who are in very difficult situations, and it can be very emotionally taxing for a lot of people. And so burnout is a big problem. So you just say that if you're going to be involved in this field, you just have to be persistent in pursuing your goals. You have to have a strong resolve. It's common to encounter these roadblocks and obstacles along the way, and you just have to find a way to power through them. And it's okay to be angry and frustrated. This was a point that was brought up by a couple of our interviewees, because being angry about injustices, it gives you motivation that you need to continue that fight to resolve these injustices. The obstacles that you come across will often be complex problems that will require creative solutions. You have to be able to think outside the box. And I think this quote from one of our interviewees, it's nice and succinct. It sums it up really well for me. We need to make room for innovation. We need to make room for people to think differently. A lot of times when you are talking to the people who make these decisions, the people in charge, they like to do things a certain way. And it's hard for them to do things in a way that hasn't been tried before. This same person also talked about one of a specific obstacle that they've encountered a lot of the times is that people will, who are making these decisions, they'll ask, okay, what data is available to solve these problems? But it should be the other way around. You should be asking, what things do we need to solve? What do we need to find solutions for? And then find the data that will help you with those solutions. Because sometimes that way you're knowing what data will work better for this. So this brings us into our policy and action recommendations. The main 4 that we came up with. So this is simple, but just interviewing people who experience it firsthand rather than just people that work there. Sometimes it's common for people who are involved, who are part of a community, to not even be included at the table when making decisions that affect that community. You need to find alternate ways to build connections with individuals to gain trust. This, I think, comes to thinking outside the box, maybe trying solutions that haven't been tried before or are unorthodox. A lot of our service providers expressed frustration with funding. So increasing funding for nonprofits is something that's really important. There's a lot of them expressed frustrations with shortages in staff and being unable to get the resources where they needed to be. And finally, like just updating and streamlining our forms for government assistance to make them easier to qualify for, easier to understand, so that, as we mentioned before, sometimes these forms are just very complicated, and that in and of itself can be a barrier to people seeking assistance. And so now we will come to our conclusion and all of our individual reflections. So the conclusion is that one of the most valuable insights about housing that has been taken from the interviews are that it is difficult to provide for your basic needs when housing is unstable or unavailable. There needs to be more focus given to making sure people have safe, stable housing. Not just housing, but safe housing, particularly in times of crisis such as now. Perhaps the most important skill, as we've talked about in this workshop a lot, is to just help those people within these underserved communities, is just to listen. Because it's, as I mentioned, it's too common for members of a community to just be overlooked and not even included when helping those communities. And my personal reflection is that there are a lot of that I took from this course in process of interviewing people, is that there are just a lot of very smart, dedicated, and passionate people who are working really hard to improve the conditions for the communities that they represent. COVID has hit these communities especially hard, but on the optimistic side, it has forced leaders to take a closer look at the conditions these communities face. I think all of our interviewees actually had optimism about how conditions could improve going forward, as a lot of these things that are being done to improve these conditions now could be applied even once the pandemic has passed.
So my reflection and main takeaways is very similar to Jason's, but what I recognized in this course in general was the amount of passion and dedication service providers have towards assisting those communities and individuals who have been hit the hardest amidst the COVID-19 pandemic, and how much harder it has made their positions. The possible solutions and creativity that has gone towards finding new ways to close gaps between services and those seeking them is on the right track for the future, yet has a long fight ahead.
So my reflection from this project was just the creative and out-of-box solutions that arose due to the pandemic. Sadly, did have to take a pandemic to challenge the old way of doing things that haven't always been accessible to everyone because they were maybe deemed too risky or unprofessional. At one point, Facebook and WhatsApp maybe wasn't the first thing that people thought about in order to connect to communities. So overall, just finding new ways to create resources and services more accessible by listening to firsthand lived experiences. And we just want to give a thanks to all of our interviewees. So Anay, Mustaf, and Rocio. And then does anyone have any questions?
Oh, sorry. Hey, my name is Marshall. I'm a colleague of Jordan's, and I am so glad that I got invited to listen into your presentations. And I used to work at a food bank doing volunteer management, and I really appreciated your view on social services and the recommendation to listen to folks receiving the services and not just the staff that work providing services. And I'm curious, was there thought about what other recommendations you can make to incentivize that practice, or how to meet service recipients where they're at, and maybe even pay them or provide incentives for them to engage that are respectful and provide them equity into in the process of getting their expertise? Thank you.
Off the top of my head, I'm not sure if we discussed with our interviewees too much detail into going into that. I think one of the big things really is just increasing funding, just because like a lot of them will rely on donations, and donations are great, but they only get you so far. So yeah, I don't know if any of my other group mates had any thoughts on that.
Also from the top of my head, just thinking one of our presenters, I think with the Salt Lake City sustainability with food, they have a program also with trying to give more community input, and a lot of it was with incentives. So being able to pay some sort of wage to those that are able to participate and give their own feedback. So just being able to pay them.
Great, and it looks like we also have a question in the chat from Luis. I know a theme that you identified was trust, and trust in the government in particular. I'm curious if the participants spoke about who they actually trust when trust in public institutions is down.
Yeah, that is a very, sorry, you can go ahead, Jason.
Oh, okay. Are you sure?
Yeah.
Okay. I just remember, I know a couple of people talked about how a lot of the people, when they don't trust the government, they'll trust like their community leaders, because especially if they're a member of a certain like smaller group, a lot of times those communities are pretty tight knit, and so they'll trust the people who are active like within their own communities. So if you had anything to add to that, Macy, go ahead.
No, you hit it right on the head. That's what I was going to say. And it's just
Okay.
important to, for those looking for assistance, to know who to trust in their, so I guess people who have helped them prior or just trusted members of the community.
We've got one more minute if anybody else has any questions. And again, feel free to put those in the chat afterwards as well.
Hi, I have a question, if I'm allowed to ask. My name is Brittany Chapman. I'm a friend of Jordan's for a long time, but I also served in AmeriCorps, and this is definitely a cause very dear to my heart. But the question that I have is kind of related to the last one, in that if we are looking at building trusted community leaders for these people, how do you think that defund the police, or a movement like that, not necessarily getting rid of police officers, but restructuring monies that may be going towards something like that, do you think that would be beneficial in this case to, what do I want to say, refunnel it to causes like this, so that people, instead of seeing a police officer who is someone who's very clearly a representation or an extension of the government, whereas are they more likely to trust someone who's, let's say, a social worker or someone at a community place that they typically frequent? And like, what would example of that person be?
Personally, I think we really, like, a lot of communities haven't had that conversation about, I guess even more of like rural communities, maybe not so much with just that statement of defund the police. I do think having that conversation of what already exists in the community that makes you feel safe is a good start. So not only identifying the places, but also the people. So whether that looks like, I guess, just people that work maybe like at a library, or people that work at the school that you know and trust, or even parents that work in that community. I think just starting that conversation and knowing that funds could be going put other places would be a good start. Don't know if my teammates want to add anything else.
Yeah, I mean, it's always like, that's an extremely fraught like issue, right, with a lot of people. I think Bianca covered a lot of things pretty well. I just think it's definitely like, you know, I believe that people should always be looking at how organizations can be improved. And so, I mean, not just like a lot of, I know I've looked at some of the budgets for some of the cities, and the police budgets are usually really huge. And I think it would be beneficial to divert some of those funds. I mean, and I don't think that necessarily has to come at the expense of like, you know, making law enforcement like unnecessary, because I think that it isn't like, it is an important thing to have to an extent. I just think that that funding towards those police departments often comes at the expense of social services, just from what I have like seen and heard. So I think that would be a good, like, yeah, definitely a good thing to look at.
Wonderful. Thank you for the questions. We are going to save some time, and I know there are a couple questions that are in the chat. And so Jason, Macy, Bianca, please feel free to answer those questions as our final team does their presentation. So our final team will be presenting on the economy and employment overall. So I will let you all take it away.
All right. Jordan, can you just nod if you can see our screen? Awesome. Perfect. Okay, thank you everyone so much for sticking with us. Like Jordan said, we are the last team presenting on the topic of economy and employment. And we just figured this is a pretty heavy topic. And so we wanted to start out with a couple memes, as that's our generation's favorite coping mechanism just for dealing with these hard times and sometimes the screwed up systems that we live in. So hope you can just enjoy those for a second. So I'm Meadow Wedekin, and then my other team members that you'll get to hear from are Hannah Hutchinson and Julian Berg. And our presentation basically has the same format as all the other presentations you've heard tonight. We'll just give you a little overview of our topic, and then we'll give you an overview of who we interviewed and how those interviews went. Then we'll kind of talk to you about our main findings and then the recommendations that we have based on those findings. And finally, we'll end with some personal reflections and a conclusion. So like Jordan said, our topic is economy and employment. And this obviously is a huge topic when it comes to the pandemic, as COVID-19 has had huge effects on the economy, just all over the place, and effects on employment and specifically people's jobs and their ability to have jobs. And so if you look at this graph, they're highlighted in orange, you can see specifically the leisure and hospitality services industry has been massively affected with the decrease in jobs in that industry by over 20%. And that's been a big deal in Utah, especially with like the ski resorts that exist here. So that's an industry we heard about a lot. But a lot of the affected industries are industries where multicultural communities are overrepresented and have a lot of their employment in those industries. And so there really has been a huge effect on multicultural communities in terms of economy and employment.
Oh, sorry. I don't know what happened there. Okay, so here is a quote from a report put out by the CDC in August of this year. And it says, the racial and ethnic disparities in workplace outbreak-associated COVID-19 cases found in Utah might be driven in part by longstanding health and social inequities, resulting in the overrepresentation of Hispanic and non-white workers in frontline occupations. So like Meadow said, minority communities have been disproportionately impacted by unemployment, and this quote is showing that they're also overrepresented in frontline occupations.
All right, and we had 4 interviewees we interviewed. Our first one was Karen Rodriguez, who is the founder and CEO of Code and Color, also the head of diversity at Purple, and a member of the Black Chamber of Commerce. Our second was Tera Petitos, who was a member of the Asian Chamber of Commerce. And our third one chose to remain unidentified, but they were a service provider for Utah's Hispanic and other underrepresented communities. And our fourth one to remain unidentified as well, and they were a service provider working in housing services. And we had a set of 5 questions that we asked our interviewees. And these questions gave a really good insight into the problems facing multicultural communities in the economy and employment sphere. Our first one focused on the employment sectors. Our second one was on access to work. Our third one revolved around essential workers. Our fourth one was geared towards the unemployment system. And our fifth one focused on what could be done to lessen these problems.
So we had 3 main themes in our findings, and we'll go over each of these in more depth, but those themes are the needs of essential workers, issues with the unemployment system, and access to work. Okay, so one of the main needs of essential workers that was brought up was access to personal protective equipment, or PPE. And our interviewees said that this has gotten a little bit better since the pandemic began in March, but it remains a problem for essential workers. Another was access to job benefits, including health insurance and paid time off. Because many essential workers don't have these benefits, sometimes they have to choose between quarantining or isolating and paying their bills. A third issue was access to hazard pay. So these are people who are putting themselves at risk, but are not being paid for the risk that they're taking. One of our interviewees said, people who are exposing themselves and at a higher risk deserve to be paid more and to have access to the same benefits as corporate workers.
The second theme that kind of emerged through our interviews was issues with the unemployment system. And here we obviously want to give credit where credit is due and recognize that there was a huge increase in demand for services, for unemployment services. And so they had a lot to face on that front. But some of the observations that our interviewees made were just generally that the whole system was overwhelmed. Their phone lines, their website, and their chats were completely down. And the website was causing computers to crash, and the phone lines you couldn't get through for weeks on end. And so that obviously is just a challenge for anyone trying to access unemployment. But then compounded with that is language barriers, which a lot of other groups have talked about as well, that people were trying to navigate the regular unemployment system and then also understand kind of how the pandemic unemployment benefits compounded with that. And then there were additional language barriers and additional access barriers. And so they've just had a lot of issues with getting personal help for questions. Another thing that maybe is more generally addressable is just the complexity of the forms that they had to fill out. That a lot of times the questions being asked aren't necessarily intuitive. One example we heard of that was the term annualized income. That's a question that's asked on one of the forms, and it's not really defined. So you don't know if that's in the last 12 months or in an average year or in a fiscal year or what that's really asking for. And so clarifying that could be helpful. And then also we heard about a lack of communication between larger entities. And so there was no real communication between companies or the unemployment system in general, and that people were kind of left on their own to navigate that, which was difficult. And so one of our interviewees actually had personal experience navigating the unemployment system during the pandemic. And she said, "Here I am, highly educated, perfectly fluent in English, and I was having difficulties." So imagine someone who didn't have those advantages, didn't have a fast computer, and didn't understand absolutely what was needed.
And our third finding revolved around access to work. And this had a kind of a trifecta of issues related to it. First one would be social issues, the second would be technological, the third one would be transportation related. The main one that we found was social issues, and with that is childcare. The majority of service workers and essential workers are women. And with the school shutting down last spring, and now again, they're shutting down again as well, and schools are going to remote work. Many service workers are having to balance this work and social responsibilities. And that's a big problem for many in the multicultural community because their jobs provide a way of life for them, and having to quit their jobs would be a big impact for their lives. And the second one would be access to necessary technology. And this was more in the case of if they were fortunate to keep their jobs or move to remote work. And many in the multicultural community aren't fortunate to have access to the necessary technology for remote work. And along with that, they don't always have the necessary education for remote work or how to use computers, email, etc. Then the third one revolved around transportation, getting to and from work. What we saw in the spring was that UTA, Utah Transit Administration, the regional transit provider in the state, they really cut their service times and options. And what that's done, it's forced people to adjust their schedules or find other ways to get to and from work. And that's become a big issue. And we have a quote here from Theta Patilos. "It was really because other responsibilities prevented them from actually getting to work. And unfortunately, for most of these people in the retail sector and the hospitality sector, the church tourism sector, they're not at the professional level, they're at the service level. So remote work is not available for them."
So now we're going to talk a little bit about the recommendations that emerged from these interviews. So for essential workers, one of the main things that came up and that we've heard already about tonight was better access to healthcare. And again, frontline workers are putting themselves at risk, and arguably they need health insurance maybe more than anyone else at this point. So that's a really important aspect of the policies that could help them. Another was, I thought this one was really interesting, having funds available for small businesses to provide employee benefits. So currently, any business that has fewer than 500 employees in the state of Utah does not need to provide benefits. So one of the suggestions that emerged from our interviews was having a source of funding, possibly from the state, that was specifically for smaller businesses to provide benefits to their employees. And finally, having more emphasis on safety protocols and support for frontline workers. And this was referencing especially frontline workers who are dealing with members of the public who might not be super on board with some of the social distancing and mask requirements. So having more support for employees who are trying to deal with possibly aggressive customers would be really beneficial.
And then the policy and action recommendations we have dealing with the unemployment system. One really interesting one that we heard from one of our interviewees was direct communication between companies and state agencies. So for example, when a company knows they're going to be laying off a significant number of workers, they could then communicate with the Department of Workforce Services and kind of give them a heads up, and that could ease the process for those employees in being able to navigate the unemployment system and knowing what needs to be done there. Also a recommendation for increased staff just available to help with questions and translation needs. As that was kind of an issue for just, handling the capacity and the demand for help with the system. Another interesting one that we really liked was a recommendation for providing resources or recommending resources related to mental health as part of the unemployment process, just because this can be a very stressful time for people who are trying to navigate the unemployment system and they don't have a job and they're looking to provide for their family. And so it can be an ideal time to make them aware of those additional resources that can be at their service. And then also finding ways to access unemployment help for those without internet access, because with like the closing of libraries and public facilities, it can be a lot harder for people to have access to the internet. And so looking for alternative ways to provide access to the unemployment system in general could be helpful.
All right, and the policy and action recommendations we found for access to work. We found a bunch of them, but one of them would be to expand access to childcare. And one method for that would be to allow childcare at work. It won't be applicable for every type of job, but maybe for the lesser intense type of jobs, we can have childcare at work and maybe employers can be involved with that. And along with that, it would be nice to allow more flexibility with scheduling for essential workers to find time for social responsibilities, but also for work while not having to quit their jobs. And another one would be allow more availability to technology for remote work, and along with that, education for transitioning. This could be with employers. They could allow the technology for their employees to use for remote work if they don't have any technology to use. And along with that, bring the education for transitioning. And another one would be allow transitioning to remote work if applicable and appropriate. And this is key to reducing risk for viral transmission for essential workers. And the last one would be to expand and not shrink our transit options. UTA is heavily funded by the state through sales tax, and the state could step up and find a way to keep the transit from keep going. And another thing they could do is UTA could reach out through surveys and public involvement and find out who exactly needs to go get to work at certain times, and then we could find a way to service them rather than leaving them in the dark.
So for my reflection, one of the first things that stood out to me, was the need to get feedback on and continuously evaluate new policies and programs. So as part of this report, we were actually looking at how a previous report that was issued at the beginning of the pandemic and how that has impacted communities of color and also what needs to be changed. And so I think along with that, having humility and a willingness to change these policies if they're not working is super important. It's also important to listen to frontline workers and members of communities of color because they have unique experiences. Many of the issues that were brought up in these interviews are things that I never would have considered. So I think it's incredibly important to listen to what they need rather than tell them what we think they need.
And as I've reflected on this course and the interviews we've conducted, I've just thought a lot about kind of going into 2020, all the jokes about 2020 vision and like the billboards that were on I-15 and things like that. But I think really, like was said at the very beginning of the first presentation, that 2020 has given us a better vision to see the existing inequities and issues in our society. because of the pandemic, those things have been amplified. And so I think with that clearer vision comes kind of more of a personal responsibility to work for equity and to address those issues. And so just personally for me, I think that means speaking up when I have an opportunity to promote equity, and then also providing a platform for others to speak up, especially in situations where they may not be comfortable. Asking myself who's missing from a conversation, and like Hannah said, just always remaining humble and teachable.
Yeah, and for me, I feel like I learned a lot and I really enjoyed this process. And one thing I really think about a lot now is that multicultural communities, they're really responsible for a lot of the economy's success in Utah, but more needs to be done to help them. And along with that, the employers and the state need to step up and find out what's going on and help protect the most vulnerable population in the state. And one of the most important things I think is to be thankful and thank an essential worker. When this all started 8 months ago or so, everyone was all about thanking the essential worker. And now I think we've regressed as a society and just kind of forgot about all that, because this pandemic is still going on and it's still very much real.
So in conclusion, we'd just like you to remember that multicultural communities have been uniquely and disproportionately impacted by the COVID-19 pandemic, especially in terms of economic stability and unemployment rates. Listening to frontline workers in communities of color is critical to understanding their needs and concerns, and it provides a more targeted and efficient way to provide relief. And finally, as the pandemic continues, this is a dynamic situation. It will be important to continue having these conversations. And we want to thank all of the people that participated in our interviews and for all of you for coming. Thanks.
You're all getting a lot of love in the chat. I just wanted to point that out.
I'm okay if we get off easy with no questions. I don't mind.
This is Nubia Pena, the director for the Utah Division of Multicultural Affairs. This really isn't so much of a comment, but more of a statement. I really want to thank Jordan and Claudia for being able to bridge the university theory and have the students really be able to apply the work. And so it has been so wonderful to see how each of you really understood the concepts of equity and inclusion and how we can create a more inclusive community by thinking strategically, intentionally, and thoughtfully, but also with compassion about how we move this work forward. So I wanted to thank you on behalf of our division, and thank you for making space for these very difficult but needed conversations so we can envision a different community moving forward. Thank you so much. And I am very proud of Claudia. I just need to just throw that love out there, just let her know I'm like a big old proud mama over here. Just wanted to put that out there.
Thank you so much, Nubia.
I have a question, if no one else does. So, I mean, one of the things that I've been thinking about is, listening is important, but then also we need to figure out how to take action and to create change. So I wondered how much you talked about that in class. I realized that change doesn't always happen in a semester. But, what are the things that you're thinking now that you've gone through this course about the next step, which is, creating change?
I would say just passing it on to someone else. I mean, take that knowledge that you've gained and try to relate it to someone else through a relatable way. And I think that's the most successful way to do that.
I think also one of the things I've loved about this class is hearing from all of the different presenters that came and spoke to us during class, and we got to hear about a lot of the experiences they've had. We got to hear about like how at the Capitol now they're having trainings on how to respect multicultural communities. I don't know exactly what the training is called, but just different things that are actually in motion and changes that are being made. And I think that's inspiring to see, because sometimes when you're one person fighting the system, it can be discouraging, but to recognize those changes that are happening, and then it just can kind of keep the fire going in you to say, I can be a part of this change. And then when you have those opportunities in your own work, just, to really grab them and run with it.
And for me, I honestly have a little bit of a hard time visualizing like what my career is going to be exactly and how I can apply these principles. So I think right now I want to keep learning and be ready for hopefully whatever situation I find myself in, and just be able to, I don't know, encourage more equitable policies no matter where I end up. So.
Okay, so first off, I would love to do sort of a virtual applause for these wonderful student presentations. We've got some reactions you can use, or if you want to put on your video. I just want to share that this has just been a phenomenal experience, and I'm just so thankful for Stacy for allowing us to have this creativity to create this workshop. I'm so grateful for Nubia and the Division of Multicultural Affairs for partnering with us on this. I couldn't have asked for a better TA. Claudia has just been extremely outstanding, and it's just been such a pleasure getting to know her over these 15 weeks together. Thank you interviewees that talked with our students. Thank you to our guest speakers that spoke with our students, and thank you to the frontline service providers that are out there, and thank you for the work that you're doing. And just for everyone that's with us tonight, we just thank you so much for taking the time to be with us. We will include the recording as well as the final deliverable in an email. So if you are interested in receiving that, please, if you have connections with either Claudia or I, just let us know. But also please feel free to just jot your email if you're comfortable into the chat, and we'll just make sure to log those and make sure that you get that information. But I just want to say that I am just so proud of all these students. To be able to see where they were from the very beginning to where they are now is extremely humbling, and so much wisdom has been shared. So thank you. I'm so proud of all of you. I'm going to ask that I'm going to excuse our attendees, and I'm going to ask that our students stay on so that we can do a wrap up for our final class together. But again, thank you so much. Please reach out if you have any questions. And yeah, just thanks for being with us this evening. And Claudia, do you have any remarks too you'd like to share?
I think as people are jumping off, just thank you so much for staying with us. I know this was a rather longer gathering, but just to echo Jordan's thoughts, I know that all of these students have grown and expanded their knowledge in their own personal way. And we've reiterated from the beginning that this is a marathon. I think someone in the chat mentioned that it's a marathon, not a race, and we all start from somewhere. And it's just been really an incredible experience to learn and grow with the students. And we hope that as we develop as practitioners, as planners, as professionals, that we can continue to have these conversations very openly about how we can, like Nubia had mentioned, create more thriving, sustainable, and healthy communities. So just thank you so much for everyone that's still here, and to Kevin and Edwin, and I think a few others that continue to be here with us that participated in some way with this class. Just couldn't have done it without you. Thank you so much.
Thank you, everyone. It's an amazing job today. Good work. Keep it up. And congrats on finishing class.
Thank you. Thank you.
Thanks, Kevin.